Hi, everybody. I'm Dr. Brockenshire, and today I'm fortunate enough to give my contribution to this topic of chronic pain. And today, what I'm going to talk about is the idea of neuroinflammation as it relates to chronic pain. And we're going to go on a walk from leaky gut to leaky brain. And I'll leave you with some really good in office tools and assessment methods to help your patients get a better understanding of why they're in so much pain, why it's not going away, and more importantly, what they can do about it and how you can help them get there. And so, one of the questions we hear most of the time in practice is, well, Doc, how did this happen? It's kind of a loaded question because as humans, we do very strange things to our bodies, particularly our central nervous system. That's nothing new. If you work on athletes, you have seen over the years some very interesting ways that they can hurt themselves. But in today's discussion, I don't want to focus on the traumatic component of brain injury and pain, but more on the chemical components, the toxicity components, pathogenic components, what I like to lump into a concept called chemical concussion, which is neuroinflammation. So when we're building a new model, at this stage of the game, we can't keep fighting against the old model. My motto for next year has kind of been to burn it down and build a new model that actually makes sense, one that can promote health and wellness and not just focus on the management of a disease state. And so if we look at Buckminster Fuller's work in tensegrity, and this kind of motivated me to look at a new model for assessing and treating the nervous system. In doing so, we built some clinical tools for you to act as a guide. Not so much templates or algorithms, because remember, there's nothing consistent about the body. It's a very chaotic mosaic. And people are getting weirder. Our treatment plans have to get more creative. But you'll notice a cornerstone of this treatment system is postural stability. And I think that's an underlying theme that continues to ring through the work that we do. One of my mentors, Dr. George Goodhart, used to drill into us that you have to look with better eyes, you have to hear with better ears, and work with better hands. And because we are observationally based, when it comes to posture, it's really one of the best tools we have to understand what's happening in the nervous system. So, let's do a better job and incorporate some more nutritional methods into functional neurology. Because when we're talking about functional neurology, we're all experts in figuring out how to find where the problem is. But one of the things that we fail to do is fully understand the health of that target area. And when you're talking about the brain, much like a muscle, if the brain is sick, if the brain is malnourished, training it with good functional neurology exercises could be detrimental because you could actually overload the situation. And I've had several cases where people have gone into a seizure state because they were overloaded with too much stimulation that was prescribed to them by their neurologist. So let's do a better job. We need some rules, make some lays of the land. When it comes to chronic pain, we have to follow the 3 rules of neurologic health. Number 1 is assess the immunomodulation. Is the brain able to clean itself? Is the immune system in a hyperactive state creating more inflammation? And so there we're going to have to talk about the recently discovered glymphatic system. We can't ignore detoxification and drainage, which relates back to the glymphatic system, but also relates to the systemic lymphatic system and how your immune system and your liver are working together to clear inflammatory chemicals. And the job doesn't stop there. When you see your patient for a 6-month follow-up in a chronic pain setting, ideally, their tissues should be stronger and more vital than when you began. And so we're going to have to talk about methods and tools that we can use to tone and strengthen the central nervous system, particularly with what some of the research is showing us today about myokines, which means we're going to have to talk about exercise. So this is kind of where we're going. This is the framework for today. So the 3 main rules we have to look at for chronic pain in the nervous system is number 1, where is it coming from? Why is the body doing this? And usually there's some pathogenic component. I haven't met um, anybody in chronic pain who hasn't had some history of some weird type of infection that has triggered situations that led to pain. The second piece is, why doesn't this happen to everybody? Lyme disease, for example. Why is it that everybody with Lyme manifests differently? So this has to do with their HPA axis and how they react and respond to stress. So the main perpetuating factor in these chronic pain syndromes is this maladaptive stress response. And then the third part of this, which answers the question why everybody isn't the same, goes back to genetics and epigenetics. And what are these people doing with the genes they were born with? And so we'll spend some time talking about things like BDNF and MTHFR, but in a limited fashion. That's a much bigger topic and something that I try to do justice to in a different session. So if we're going to talk about pain, we need to get a grip on pain. We need to understand where it's coming from and how it works. And so we know that the nociceptors depolarize and you feel pain. It's a simplistic view, but for our argument, let's roll with that. One of the top compounds that can depolarize the pain receptors is histamine. So if you're doing food allergy testing or you're working with people who have allergies, you know that if you can get a grip on histamine, you can reduce their chronic pain levels. You can also tell from a leaky gut point of view that anybody with leaky gut is going to deal with food allergies, which then leads to a greater inflammatory state. So we've got that whole gut-brain connection going on with allergies through the compound histamine. And remember, histamine is an inflammatory neurotransmitter / hormone. So pay attention to what people are telling you, particularly when it comes to their diet and lifestyle. And this idea of inflammation causing pain, well, we know that pain and inflammation are deeply related. And in nature, there aren't very many analgesics, but there are quite a few natural anti-inflammatories. And so we were built to use inflammation to our advantage from a survival point of view. So when we look at inflammatory pain from a neurologic point of view, we keep running into an autoimmune state. And you can't have a neurologic autoimmune situation without having runaway inflammation. So we've made a pretty good argument for this concept of neuroinflammation. And we'll talk about what it looks like in patients. But make sure you explain to your patients that you're not just treating their brain, right? You can't treat the brain without treating the body and vice versa. And they have to be in this as well. They've got to be willing to work with you. They've got to be willing to make changes, slow and steady. You don't change overnight. A lot of these people were trained into this dysfunction, so you actually need to train them out of that. Sometimes it takes longer to unlearn what they already know than it is to implement a new system. And in science, that concept rings true because the medical community is having a difficult time really wrapping their head around the whole gut-brain idea and the concept of the microbiome and how that interacts with neurotransmitters. But let's just keep it simple. Understand that we have an enteric nervous system. It is vagal mediated, and it's a second nervous system. It interprets the world around us. So pay attention to those gut feelings if you've got a healthy gut. A lot of dysfunction in the nervous system starts in the gut. And so our gut is a sensory organ. And explain that to your patients, that a lot of what you think and feel and what you perceive as reality comes from your enteroendocrine system. So any inflammation down there is obviously going to lead to more inflammation in the brain. Some 3 takeaway points from a microbiome discussion are: number 1, any spike in stress will lead to a spike in pathogenic bacterial growth. For example, if you have dysbiosis and that dysbiotic bacteria is E. coli, and you have a sudden cortisol spike due to some type of stress, whether you were hit in the head or cut off on the highway or you missed your flight or getting searched at TSA, whatever it might be, every time that cortisol spikes, expect about a 10,000% increase in pathogenic bacterial growth. as that's happening in the small and large intestine, those pathogenic bacteria start eating our iron as their food, and that explains why you're starting to see low ferritin and anemia in a lot of your patients, particularly your chronic pain patients. Because the more inflammation that you have in your system, the less ability you have to absorb complex minerals. And iron is difficult to absorb. The longer you're under stress, and let's face it, chronic pain breeds more stress, you end up in this cortisol-dominant adrenaline state. Adrenaline will increase more biofilm production. And the more biofilms you have, the less you are able to absorb nutrition. And so these are the ways you kind of have to think about these chronic pain patients, is that it's not just one thing. It's coming at you from a lot of different places. So when we're going to talk about stress, I don't want to talk about the adrenals. I want to talk about the whole system. Let's focus on the HPA for a minute, the hypothalamic pituitary adrenal system. And look at some of these factors, particularly hippocampal atrophy. So if you start thinking about what it means if your hippocampus starts to shrink, that's obviously not good. But chronic long-term stress leads to insulin resistance. It leads to autoimmune thyroid diseases. And most of your patients in chronic pain are somewhat depressed because they've been in pain forever. So their serotonin and dopamine ratios are all out of whack. And the way their amygdala is perceiving stress is changing. And you can see these in lab work. If you start to see free fatty acids going up, and you see free insulin going up, and you see this abnormal ratio between VLDLs and LDLs. I had a patient recently whose VLDL was twice his LDL, which is quite alarming from a coronary vascular issue. So pay attention to the type of stress your patients are under, because hippocampal shrinkage or atrophy is another hallmark of Alzheimer's. And when we break Alzheimer's down into 3 categories, if we look at the inflammatory category, which you can measure and you can look for, that's the portion of the Alzheimer's cascade that relates back to leaky gut, diet and lifestyle, but also poor oral hygiene. And we know that chronic inflammation in the oral cavity will lead to greater neurologic inflammation. So pay attention to your patient's oral health, because that's a big thing that's getting missed here. When we look at Alzheimer's, because your patients are asking about it, because it's in the media, fake news and real news have this. We know it's a looming epidemic. These are the nutrients that were shown in the UCLA Buck study to improve the outcome of Alzheimer's patients. And you'll notice that most of these nutrients are in their natural whole form. These are not isolated extracts. When we look at curcumin from turmeric, for example, hundreds and hundreds of studies on the curcuminoids from turmeric, but take a look at how it modulates your inflammatory cytokines. And so curcuminoids are a huge player in neuroinflammation and the management of chronic pain. This is not a painkiller. This is not a natural NSAID. This is how it works. It impacts NF-kappa B, nuclear response factor, heat shock proteins, p53 tumor factors, so on and so forth. Plants are a key player here, and they could represent one of the best tools we have going forward to combat neurologic-related illness. So start brushing up on your botanical medicine. Rosemary, for example, great culinary spice, but as an essential oil, the scent of rosemary can reduce peroxynitrite damage on the nerve endings. Right there, that makes it a winner, because a lot of people walking around in chronic stress who have chronic pain have elevated levels of peroxynitrite, and they're also overproducing inducible nitric oxide, which leads to more and more oxidative damage on the nerve, which equals pain. So rosemary plays a huge role in helping neurologic chronic pain, not just from an essential oil point of view, but also as a botanical supplement. So keep your eyes on rosemary. But to get an idea of how this inflammation is forming in the brain, we have to talk about the blood-brain barrier. And if you went to school 20 years or more ago, like I did, we were taught that the blood-brain barrier was not permeable. Today we know that to be false, and we know that the blood-brain barrier is permeable and that things can move in and out of the blood-brain barrier. These are some of the things that break that barrier down. And most of your patients are subject to this chart. The reason the blood-brain barrier becomes leaky and inflamed has to do with the microglia. As these guys start to get activated, if they're overactivated, just like in the gut, the lining of the brain will start to form gaps, and that's how things can get in. Things like viruses and parasites, parasites like Toxoplasma gondii. So if you have a cat, you'd be very suspicious about the health of your brain. Check out Toxoplasma gondii. For looking at the triggers of inflammation once that leakiness has happened, the blood-brain barrier permeability in itself is a source of inflammation. Anemia is a source of inflammation. Drugs, alcohol, environmental pollutants, so on and so forth. Leaky gut is a source of brain inflammation. All of this shows up as these symptoms. Mostly your patients will talk to you from the standpoint of brain fog, but if you're hearing a lot about brain fog, keep in mind that that's often caused by mycotoxic exposure, so mold exposure, which is a source of inflammation, particularly in the brain. Another source that your patients are being exposed to is gluten. So if you're on the fence about whether or not gluten is the real deal, it is, and we know that this is what gluten does to the brain. So not everybody responds the same to gluten. In any treatment plan involving restoration of the brain and dealing with chronic pain, you have to make sure that you investigate gluten. I would recommend that the patients remove gluten from their life for at least 3 to 6 weeks while going through a recovery plan. But that just lowers inflammation overall. So it's not that they're allergic to gluten, but it does add inflammation to the system, as does dairy. Every chronic pain patient that you're going to come across has had some exposure to some bizarro infection, whether it's mono, Lyme, mycoplasmas, mold, etc., heavy metals. They're all there and they're all playing a role. They can be triggers in of themselves. And when you trigger neuroinflammation, you're going to notice that if you follow the cascade, you end up with the dreaded neural cell loss or brain shrinkage. So if you explain to your patients, look, man, you got to lay off the pizza, just 6 weeks is all I'm asking, because if you don't, you're going to end up with dementia. That usually gets their attention. Are we exaggerating? Of course, but we have the science to back up that statement. If you're trying to promote neuroplasticity, you have to address neuroinflammation. If you're promoting energy and anti-aging, looking at mitochondrial health, you've got to look at neuroinflammation. And so I like to practice upstream medicine. If we have problems down here, I want to track it all the way back to the source. If neuroinflammation is the source and chronic pain is driving that, then we have to find out why this happens. So, what does this look like in your practice? Obviously, posture has been a big theme. So postural distortions play a huge role in showing us whether or not there's neuroinflammation. Moving the eyes in multiple forms of gaze beyond saccades, not just vertical and horizontal saccades, but actual convergence and balance testing will show neuroinflammation. If you've got a patient that switches between left and right hand, that could be because of neuroinflammation. There are physical reasons for neuroinflammation. It could be subluxation of the spine or the cranial plates. There can be dental injuries, dental infections, and so on and so forth. So you're going to find it if you ask the right questions. I love asking people about how clumsy they are, particularly with kids. These kids are walking into the wall all the time, and it only happens after lunch. You have to wonder, what are they eating at lunch? So let's ask better questions. When you need a test in the office to measure a patient to see where on the scale of neuroinflammatory dysfunction they are, just think of the Romberg's test. Classic neurologic test. You can just stand with your feet together, You know what, better yet, let me just show you how we do a Romberg's test and how we do a modified Romberg's test to evaluate neuroinflammation. Today we're going to demonstrate a Romberg's test and a modified Romberg's test with a challenge to try and elicit the most out of your neurologic exam, particularly looking for neuroinflammation. So the first step of the test is to have the patient stand on a good footing, preferably barefoot, with their feet together, and instruct the patient that they might feel a little wobbly. That's okay, but the first rule of the Romberg's test is don't let the patient fall. So, step 1, feet are together, correct. Step 2, put your arms out in front of you, palms up. Step 3, close your eyes and don't fall. You have to do this for at least 10 seconds, preferably 30 seconds. And note any particular sway that happens with the patient. Perfect, open your eyes. Another thing to note is that to do this test correctly, patients must be at least 8 years or older from a neurodevelopmentary point of view. So the modified version of the Romberg's has the patient stand on one leg. I let them choose the leg with their hands relaxed, their tongue in their mouth, and their eyes open. They stand there and breathe for a minimum of 10 seconds. Once they've demonstrated that, I'll have them look through the 6 cardinal signs of gaze without moving their head. So look your eyes to the left and don't move your head. To the right, look down to the floor, look up into your head, and I want you to look at your nose. And pay attention to any sway or shift in their balance. Excellent. Are you balanced and comfortable like that? Perfect. The final piece of this modification is to have the patient close their eyes and try to stay standing for, again, a minimum of 10 seconds. And any failure needs to be noted, particularly the side of failure, which indicates the region of the lesion, which is usually an inflammatory lesion, which we cover in our neuroinflammation workshop. Okay, to enhance this test for individuals who have exceptional balance, we'll use a Bosu ball. So stand up on the Bosu, please, ankles together. And this is just going to challenge the brain even further in an unstable environment. Feel balanced? Okay, arms in front of you, palms up. Close your eyes when you're ready, don't fall. And you can see how the instability challenges the brain at a much higher level than just stable ground. So we use the Bosu for our advanced athletes, gymnasts, figure skaters, ninja warrior types, etc. So you'll notice in that case that that young athlete definitely had postural distortions, but she's also had a multitude of closed head injuries, and quite a few food allergies. So she's on the mend, she's getting better. You will find issues in patients if you challenge them correctly. So you've got to make them work. You've got to use things like a wobble board or a Bosu ball or complex movement to really elicit some of your really fantastic balanced patients, because you're going to find it. It's there. And when you're finding the imbalance, if you correct it with nutrition and restore the brain's ability to clean itself, you then repeat the test and they'll notice right away. They say, hey, that feels a lot better. So in my office, we'll actually dispense some liquid turmeric and have them repeat the test. And they'll find a huge improvement in balance. Another one we use a lot is methylated B12. So we'll spray some of that in the mouth. And B12 helps drain the brain. You can test that, do that Romberg's modified before an adjustment and after an adjustment and see what's changed. Because what we now know about the glymphatic system of the brain is that it drains into the deep cervical lymph nodes of the neck. So if you have neuroinflammation and you deliver a really artistic chiropractic adjustment to the cervical spine, you'll be promoting drainage out of the brain. The Romberg's test should improve. And so start testing your patients, and you can have them test themselves at home. I have some patients who are addicted to stimulants, and they will use a stimulant and they'll notice that their balance gets worse. So, the Romberg's test is underutilized. Start using it more in your office and play around with it, see what you get. But through the research on the lymphatic system and how the immune system works in the brain, making that connection between the sinuses, the deep cervical lymph nodes, and the meninges, we now can see the lymphatic vesicles in and around the veins of the sinuses. So we've got lymphatic vesicles and microvesicles throughout the dura and the brain to drain the brain into the systemic lymphatic system. That right there becomes a mechanism for why chronic pain is so difficult to manage medically. So, what happened? One of the reasons we're seeing such an uptick in chronic pain related to neuroinflammation is nobody sleeps well anymore. Part of it is because we're all overstressed and poorly fed. The other part is we're in front of devices too much. So you've got the whole electromagnetic field, electromagnetic radiation stress. We have way too much artificial light, blah, blah, blah. You can go on forever. To help people understand why sleep is so important, I show them this slide and explain to them, look, one of the problems of lack of sleep is your brain isn't able to clean itself. And if it can't do that over time, you're going to end up with more inflammation, more sensitivity to pain, a decrease in insulin sensitivity, and cortisol spikes. And what have we learned about spikes in cortisol? They will lead to dysbiosis. So you've got to track people's sleep. It's getting much easier to do that with the personal data collection devices like Fitbits or Garmin's, etc. So track their sleep, use their heart rate, check heart rate variability, and see if they're really sleeping or not. Because a lot of times people don't understand what happened to them because they didn't do anything different, but you find out they're not sleeping at all. And so sleep studies do have a value here. The way this works, and the reason that the gut and the brain have kind of bumped into each other in this topic, is the neurotransmitter substance P. So we can go on and on about dopamine and serotonin and melatonin, and everybody should understand at this point that these neurotransmitters are formed in the gut, distributed through the central nervous system. But substance P doesn't get much attention, and the reason we're going to talk about it now is it is a neuropeptide, and it's responsible for hypersensitizing nerve membranes. So if you have too much substance P, your nerves feel pain more. They're hypersensitized. It's a survival tool. It helps us get to where we are, but it does increase our perception of pain. And the more inflammation you have, the more substance P you have, which means the more receptive to pain you are. This could be one of the mechanisms behind the research that shows that smokers report a 90% increase in low back pain, that people who are morbidly obese report a 40 to 60% increase in systemic pain. So not everybody feels pain the same way, and a lot of that has to do with substance P. Substance P is also our intersection between the immune system and trauma. So people like Lyme patients who have neuroinflammation and chronic pain, it's because of how substance P works. Substance P is key when it comes to stress, and its target tissues are the hypothalamus, the amygdala, so on and so forth. And we've already established that the amygdala is the region of the brain responsible for stress-induced heart attacks. So there's something going on with substance P. The fact that it initiates the expression of all inflammatory immunologic messengers should make you stop and pay attention for a minute right there. This is the smoking gun that allows infection to cause neurologic pain. Think of shingles. People with low magnesium will have elevated substance P. Most people have low magnesium, so start testing and correcting for magnesium deficiency. My favorite magnesium is the glycinate form. Keep in mind that the amino acid taurine can promote the maintenance of magnesium. So you can go a lot longer on magnesium if you add a little bit of taurine. People with too much substance P, they look like this right away: disrupted sleep, poor response to stress. Basically, these are your chronic pain patients. Look at the digestive inflammation. This is a vagal situation. People with poor vagal tone are more susceptible to infection, and at this time of year, you're going to be seeing a lot of walking pneumonia. Pay attention, because walking pneumonia and other sorts of mycoplasmas increase sensitivity to substance P, so they will have a greater sensitivity to pain. Mycoplasmas and Lyme typically go hand in hand, so with your Lyme co-infections, I love talking about Lyme, you'll notice that one of the hallmarks for Borrelia is transient joint pain, and it can take 6 months to a year for those symptoms to show up. So a lot of your chronic pain patients neurologically have Lyme. It may not be the primary, but it's definitely a player. And we do a whole lecture on Lyme. I've got a great seminar I did in Toronto with some colleagues on cloaked infections that's now available to you at no charge as my gift. Watch it, learn more about these chronic infections and how they wreak havoc on the nervous system. Because when it boils down to malnutrition, it's not that your patients aren't getting enough today. In fact, a lot of people get too many nutrients. It's that because of infection and inflammation, they can't absorb them anymore. Or genetically, they don't know how to use them, or they're eliminating them because their systems are so upside down and medicated that their mitochondria don't do their job anymore. Because of that, you have to look at patients a little differently. So when we burn down the old system and look at the new system, we pay attention to these 6 key factors, because all of them will play a role in chronic neurologic pain. My rules are: deal with the superficial right away. Those are things like blood sugar and digestive dysfunction. Do the Romberg's test, find the dominant lesion, do your neurologic testing, find out what stresses those lesions, treat it, fix it, make it stick, show the patient how to do their exercises at home, make sure they do them at home, make sure they video those exercises in your office so you can send them home with a recording of them doing it in the office. Everybody's got a device today, make use of it. And when you're doing all of this advanced work, keep in mind that you have to be mindful about what you're doing, because these people have been suffering a long time. So you're their partner, you're in it to win it, and they're going to be successful over time once you follow those key rules. They're going to ask you about if they can take anything for pain. And some of the key players for chronic pain neurologically: vitamin D, magnesium, and mineral supplementation. You've got to fix mineral deficiencies. Most people are dehydrated, so they need to look at minerals. Minerals will help their bodies hold water in the cell. Another way to come at it from the medical research is break it down, and I've done this for you neatly in the quadrants. So from a neuroinflammation point of view, take a look at those botanicals and nutraceuticals. From an antioxidant support point of view, same idea. What I've done is blended the botanicals so they work better for you. For example, if you're using broccoli sprouts for the sulforaphane, add a little glutamine to it and the uptake will be improved. If you're using Boswellia serrata, make sure you mix turmeric and an oil with it, and it'll work much better. It's all about putting these natural nutrients into the bloodstream, and that's how you do it. You'll notice there's a lot of overlap. The reason being that our muscles play a role here, and we can't talk about neurologic pain without talking about movement. So when you look at all the myokines that are secreted by moving muscle, and we look at HIIT training, this basically gives us another solution besides nutrition. So I treat exercise as a form of nutrition. It's movement nutrition. It's vitamin M for movement. You'll notice that good HIIT training leads to beneficial serotonin and dopamine balance, improved growth hormone, stronger heart contractions, better circulation, less inflammation. So we've got to get our patients moving, because if they don't understand the correlation between movement and posture, there's really no point in going forward. When you look at these two standing there and you look at their posture, you can see that digital posture, the gaming posture, what we call Gru neck. If you look at Gru from Despicable Me, GRUNEC is that digital dementia presentation. But it's all correctable. You just have to know how to look for it with better eyes and ask better questions. Thank you.